Namaste everyone. My name is Dr. Jankana Butch. I'm serving as a Chief Medical Officer at Apollo Ayurvedic Hospitals. Today I am here to share my views on restoring well-being and sustained well-being by application of classical Ayurveda wisdom. We come across many patients and even very healthy individuals who seem to be very healthy but yet struggling with multiple issues and looking for techniques and solutions to ensure good health and sustained well-being. So keeping that in mind, today I am here to share my views and Ayurveda wisdom on whole person health and well-being and sustained well-being. So I will be talking about this, incorporating various Ayurveda fundamental points. Before we begin that, let us talk about that overall evidence suggests that connecting with nature is one path to flourishing in life. While we are talking about health, let us also understand that we, as young professionals, and most of us in many leadership positions, currently we are all struggling with a common concern, and that concern is how to balance one's own personal life, one's own professional life, and neither of that should take a toll on each other. And in all this that is happening, we need to ensure that we are healthy. So, as you can see in my slide here, so beautifully, this is taken and referred from International Journal of Well-being. So while we talk about evidence, we talk about systematic work, scientific rationale, I thought to begin my slide with capturing hardcore evidence from the Journal of Well-being, International Journal of Well-being. And it says there was a study which was conducted, and it says that connecting with nature is one path to flourish in life. You can see here a group of children from Africa, and they are seen to be experiencing and exhibiting well-being. They are not in the best of their climatic situation, as you can see, or it could be food or many other things. But it indicates that well-being is something which is not external. Irrespective of our external environment, more important it is to focus on inwards. So, well being is scientifically dependent on endogenous molecules that impact feeling of happiness. I am stressing lot more importance to this slide and to this reference that is there because I want all of you to note that we in leadership position, we as corporate employees and all of us are here are earning very well. We have lot of external exposure, going to different countries, eating in very well placed eating places. We have best of our clothes to wear, everything. Irrespective of that, one thing which is missing is probably our inner environment. And I want all of you to pay your attention to that point, that well-being is something that is inwards. And who talks about well-being currently in modern perspective, in conventional hospitals for lab investigations, wherever you go, you would rarely find a physician talking and asking about your well-being. People do talk about mental health, state of mind, but well-being is very less spoken. It is not coming in the forefront of health. One system that does that, and that is Ayurveda. So, my contribution for you today would cover in understanding shift in age trends that is helping. We will go through quick take on Ayurveda fundamentals, small triggers which leads to awareness, current problems that the health system is going through, understanding different body types, exploring Ayurveda's benefit and scope of integration. I would also take you through Apollo Ayurved's journey so far, as we are leading currently in India and in across the world the concept of process-driven precision Ayurveda. This would also at the end lead you to rethink about medicine and about ways of living to live better and longer. Next time you visit your physician or you go for health checkup, I am very sure that there would have been some points that have been changed your perspective towards looking at health, towards looking at disease, and towards looking at your own balance or homeostasis would have changed. And with all this, I want all of you to carry out a small exercise, a small artwork, which I will be showing you at the end of my slide. That is about crafting your own unique timeline of health and disease. On 7th of April, World Health Day, Apollo Hospitals published the State of Nation, Health of Nation report. And you would be amazed and also stunned to see that how Indian health quotient is changing. The quick report is not only insightful, but it is also alerting as to how we need to mend, we need to change our lifestyle and our perspective on viewing of health into becoming healthier, fitter. So, key findings that we find that compared to the Western population, Indians are witnessing the onset of cancer a decade early, accounting to a major cause of death. Prediabetes is increasing among young adults, and this is less than 45 years. Various reasons, sedentary lifestyle, as well as food type of work, night shifts, so many things are contributing to this metabolic syndrome precursor. The country seems to be confronted with a range of cognitive disorders and non-communicable diseases. We can see a lot of young professionals who are afflicted by anxiety, depression, lack of good sleep, and mostly people on night shifts or even with their own habits, irrespective of that, the state of mind which is a lot more occupied, we are seeing that younger generation is affected. There is a silent killer which is among us, that is hypertension. There is a rise in it like anything, from 9% in 2016 to 13% in 2023. Again, more with younger generation. I would like to add here that in my last 6 to 8 months of practice itself at Ayurveda hospitals, I have seen individuals within age group of 30 to 35 coming with essential hypertension very early in life. About months later, I see them coming with a follow-up sequel where they see that creatinine is gradually rising. I also see young patients of nephropathy, IgA nephropathy, who give me a history that I was diagnosed with hypertension a year back. So this is something that I would like to note how the health trend, health quotient is changing. But does this mean that we cannot do anything about it? Yes, certainly. We can do a lot more. We can take care of this, we can steer this, we can arrest this progression, not just by running to labs to do health checks, etc. Certainly, screening health check is very important, but action points arising after that, and action points which include Ayurveda is something that will help to change this health scenario. This was State of Health report published last year, and Apollo Ayurveda hospitals contributed to this, where we found that 66% of individuals have 3 or more impairments. And high prevalence and severity of quality of life was across this age group of patients. Sleep, state of mind, metabolic health, and vitality were key impairments. And therefore, quality of life dimensions form an integral part of health assessment protocols. We know about lipids, we know about cholesterol deposition. We start getting ourselves checked at 35, 40. But I would like to let you know that atherosclerosis begins from the first decade of life. That is when we are in our age group 1 to 10. Therefore, just above the reports are important that how children in this generation, children at our home are taken care. Right from first decade, food exposure, sedentary lifestyle, binge watching, these are some of the very preventable and modifiable health risk factors which need to be considered. Because in a given body, the disease progression is not immediate. It is not that today you did the blood report and yesterday you had cholesterol deposition. It is a timeline of so many years. Every mutation that is happening, whether it is for cancer or Parkinson's, it is happening every second. We need to keep this in mind. The disease process is going on. Similarly, for diabetes, we can see that prediabetes or insulin resistance peaks up much, much earlier than the actual onset of diabetes. Therefore, it is important that we seek help, we seek support, and we bring in Ayurveda system of Indian medicine very much as a part of our care process. Let us now quickly focus on some of the words like Ayu and Veda, which makes the word Ayurveda. Ayu is longevity, longevity with fulfillment. It means self actualization, looking into ourselves, and it is totality of life. Ayu is something where it is continuously associated with consciousness. It is associated with awareness. Right from the time of a sperm and an ovum meeting, forming a zygote, there is Chetana, there is consciousness, and this is Ayu, knowledge that helps us to understand and preserve life, corrective measures to align desire and knowledge. This whole thing is Ayurveda. Now, some more fundamentals as we can see that Smriti, Dhi, Dhriti, and Pragna. You can just keep this in mind while it is slightly deeper, but what it means is that your desire or pursuit towards achieving good health will lead to intelligence, will make you aware what should I do to take care of myself? What are the causative factors that I should be aware of? Lot of people who come to us or many of us, we are not aware that there is some kind of ignorance. Suddenly when somebody clears that somebody is an Ayurveda physician who is well trained, well qualified, or Ayurveda reference books where you are getting aware and that leading to an action with control. You take charge of yourself. I would like to quickly quote an example like today morning from my consultation, a patient of diabetes who says in a week's time, doctor, I am telling you that I was eating like an animal. What has changed is that now I know my body, I know how much should I eat. Now I am an ambassador in my office to go and tell people to make portion size, to view on what are they eating. So therefore, this is harmony, which is springing from awakened consciousness. And this is all based on causative factors, symptoms, and therapeutics. So with this, Ayurveda defines good health as good appetite, good metabolism, good sleep, restful sleep, where you are able to have a very good and a quick sleep initiation time. You are able to have a deep sleep. You are able to wake up in a very fresh condition, cognitively very alive and alert. There is no headache, there is no neck pain, you are not groggy, no joint stiffness. That is the outcome of a very good and restful sleep. Clear excretion, which means bowels which are very clear, on time, consistency is well formed, there is no pain, there is no bleeding. Similarly with urination, no repeated urinary tract infections, urine frequency, urgency, hesitancy, everything around urine color, everything which is very clear. Clear senses and alert. Your eyes, ears, smell, touch, every sense organ is functioning to its optimum. Mind is alert. And also concept of a cheerful, calm, and self-aware mind. You are not into an aggressive state of mind all the time. You find joy in whatever you do. You are not reactive. You are able to be resilient in all situations at your work, at your home, wherever you are. And this filling you with vitality and leading to a good health, a sense of having a long life. This comes from within when you have all these parameters that are in place. So this is a good method of scanning oneself. We would be ahead of other scans and lab investigations. We would be able to make a note. Am I having all these things correctly? So this is one exercise that I would like to leave all of you to do a self-check. We need to understand some of the Ayurveda building blocks. Ayurveda says that whatever is happening in the universe is happening in our body. We are made of 5 penta-elements, Panch Mahaput, and that leads to combination of those Panch Mahaputs leading to formation of Vayu, Pitta and Kapha. Vata, Pitta and Kapha. That is three doshas. With this, we understand a very common buzzword: know your constitution, know yourself, know your phenotype, know your genotype. We know, we have heard about this. This Ayurveda has told Prakriti. At the same time, as we understood that right from zygote formation till death, while there is Prakriti, but we are under multifactorial influences. Influences could be from diet, lifestyle, state of mind, infection, so many things that a human body is wrapped with. Always there is a chance of Vikriti. Prakriti and Vikriti go hand in hand. And because of this, we always get mixed up. Am I the health and the disease? That fundamentals keep mingling with each other. But Ayurveda has a method to find out Vikriti Lakshanas and can also decode one's own Prakriti, which leads to Swasthya. We need to understand fundamentals like Agni, Ama, Dhatu, Srotas. These are all Ayurveda functional and anatomical building blocks on which pathways of diseases are framed. Interlacing of each of these things can understand and can help us to understand the state of health and disease. A famous concept which is there, which is Roga Samprapti. It is when these units, anatomical and physiological units, they mingle with each other, interlace with each other. There is a crosstalk which is happening between these units, between the organs that is there, which is known as Samprapti. And this clinical pathways, this pathogenesis leads to a formation or manifestation of gradually disease that is there. With all this, all this is happening in a body of a patient or a host, which is Rogi. We need to understand influencers of food, we need to understand three gunas. It is a very deeper concept, but we can go through that quickly. And quickly, just to note that sattva, rajas, and tamas are three gunas which are state of mind. Again, these gunas are also known as manodoshas. This with the combination of tridoshas, combination of that and Panch Mahabhut leading to formation of trigunas. There is kala, that is stage and age of life, seasons of life, and bala, our own strength which is there, and dinacharya and rutucharya, that is your daily routine and seasonal routine. So these are very fundamental primary concepts. They may sound a bit difficult, but once when you understand very basics of this, you would be able to apply the learnings in your health and disease. We spoke about the fundamental concepts of Panch Mahabhut. We spoke about Agni. As you can see, the three types of phenotypes of host that is here. So all this, whether it is Vata, Pitta or Kapha, these different types are all based on the outcome is metabolism. So Agni is responsible for longevity, complexion, swasthya, utsah, that is motivation, normal growth, luster, innate immunity, and body temperature. Even the existence of an individual is because of Agni. So the applied aspect here is if somebody is working on improving one's own complexion with external things, with laser, etc., key is to stop there and just not take a single external approach. It is important to look back to your metabolism. What is the fundamental base that is making your complexion weaker, that is making it more darker, or which is without radiance? Why? The answer lies within your body. Again, we spoke about ama, that is inflammation. Agni, leading type of Agni. There are four types or states of Agni. Either it is hypo, it is impaired, it is not functioning to its optimum, or it is hyper, over functioning, or it is varying, sometimes hyper, sometimes hyper. And the fourth state is a state of balance or a state where it is very well lit and kindled. So the other three types of Agni, which are not normal, can lead to acute or chronic inflammation, which in Ayurveda is known as ama. And deposition of this ama or inflammation is responsible for various medical conditions. Applied aspect. There are Ayurveda points which are told to know. How do I know? Do I have ama or not? You can quickly check how is your tongue. Is it coated with white, heavily white coated tongue? Does your poop sink or float? It is important. Stool which sinks is known to have ama. A floating stool, a lighter stool, indicates that intestines, stomach, everything, it has digestion, assimilation, reabsorption. These processes have gone very well, and outcome of waste product stool is also not is not filled with inflammation, and therefore it floats. So quick thing, this which you can check to know yourself whether you have ama or no. And this understanding, as we spoke through, now you can imagine that once everything is laid down, it is kind of a systems thinking which is applied, where I am in the center, my past, my medical history, my current health status, the environment where I am in, the age, the decade of my life, my own health potential, how I am eating, how I am, my own health potential with respect to genetic profile is where, how my parents, my grandparents, is there any inherent hereditary factor which is lying, and my own personal habits. Combination of all these things lead to the prognosis, or it leads a foundation for health and disease. During this points of evolution that are happening, there are various fundamentals that we spoke of: Agni, Ama, metabolism, and inflammation, which are playing a key role to derive your health outcomes. You can imagine yourself, you can imagine yourself standing on a seesaw and you are trying to balance yourself against physical stressors, spiritual stressors, various emotional and mental stressors. Quick example: you are currently in Bangalore and then moving to a different city. Are you able to maintain your good health? That is where is the key thing, that you may be stable in certain environment, change in environment leads to disease. This everything forms a host environment, microenvironment, which is leading to medical conditions. And we spoke about Vayu, Pitta, and Kapha. These are quickly some of the pointers that you can keep in mind, that Vata, the physical characteristics are that person is lighter, there is dryness of skin, fast in action, unsteady movements, relatively smaller bony structure. Pitta is medium, and a Kapha person is always towards heaviness, sluggish, steady movements, relatively broader and bigger frame. Mental state: Vata is unsteady, varying from one point to other. Pitta is very clear and focused. Kapha is steady, and this, in terms of thermodynamics, can be understood that whenever there is an entropy, it is Vata, which that facilitates towards enthalpy. Breakdown and assimilation is Pitta. Kapha is enthalpy. All this is applied to seasons of and cycle of life, which brings into account current season, time of the day, state of digestion, time of life. So we go through this every day, and our health is determined by these dynamic changes. Our body is always aware, the biological clock inside is working towards to match this. I can give you a quick example of time of life. Somebody, a woman who is listening here, a female participant, will be able to correlate this. You are at 40 or you are at 44 and moving towards perimenopause and postmenopause. You will be able to quickly relate, you will be able to find out how things are changing with respect to your menstrual cycle, with respect to your state of mind, your own ability, cognitive ability. Doesn't mean that time of life can always dominate. Yes, time of life can influence, but if you are aware about the changes that are happening during this phases of life, ahead of that phase of life arriving on your timeline, you may be able to plan. You should be able to plan a very good preventive plan for your health. We saw about this. This is relevant in terms of time of eating. 6 a.m. to 10 a.m. is a kapha kal, which is important that people do utilize this time for good exercise, physical activity. Once that is done, 10 to 2 is a time of high pitta. Metabolism is peaking. You should eat during this time a good lunch. And then 2 to 6 is vata kala. As sun sets, it is kapha kala. It goes through the cycle again. 10 to 2 is pitta kala, and 2 a.m. to 6 a.m. within that time, like 3 to 4, with that time, again Vata Kala, but is also has a specific impact of Brahma Muhurta, where you can carry out some of the activities which put your mental faculties at work, where you are able to concentrate higher in Brahma Muhurta Kala. Implication of this to current generation, you should look at this with respect to your intermittent fasting. People on intermittent fasting should pay attention to this. If any of you is on that kind of a period of intermittent fasting and yet suffering from gas, bloating, or gastric reflux, you need to put that cycle with respect to this dosha cycle and should be able to correlate. People who are exercising excessively in the evening, we see a lot of people going for gym, etc. in evening. Again, that between 2 to 6 p.m. is Vatakal. And that is the time where degeneration, entropy is highest. You are adding a stimulating activity. You may end up having an influence of that in many ways. This is again various seasons where summer is where Vayu peaks up. It also where some it peaks up, and then in Varsha Kal again you can see influence of Vayu. Pitta peaks up in Varsha Kala. In Shishir and Vasant Ritu, uh, Kapha, which is on a higher side. And during this, why this is important, your adaptation of diet, lifestyle, all activities can be planned according to seasons and dosha dominance. We can see here also, similarly, Kapha, Pitta, and Vayu in the seasons of life. First 25 years, kapha is inherently high, which leads to growth, sustenance, all that. Pitta is where 25 to 60, you are at peak of your professional life, peak of your cognitive abilities. And then 60 and above, where degeneration sets in. Overall lifespan, Ayurveda says, is possible up to 120 years. But during this, each of the decades, there is dosha dominance, there is cycle of life, physiological changes that keep happening. One needs to learn to strike a balance against this. Here, implication is that we do see sudden deaths, we do see post-retirement or just at that time conditions like Parkinson's, various motor neuron diseases, metabolic conditions, etc. Actually, it is not that they, as I told you earlier, that it is a recent onset. The origin is going on for decades of life. It is important that we understand the difference between anna and ahar. Anna and ahar are two terms which are applied. Anna is digested or eaten through mouth. Ahar is everything which goes inside, which is also through sense organs and mind. A binge watching, right? Continuously on mobile, uncontrolled screen time, moving. We saw very recently a thing called popcorn brain. Is a concept that has come and neurological sciences, neurologists are facing currently people coming with popcorn brain, which means that constant stimulation from screen time, constant stimulation on gadgets, leading to brain which is extremely overactive. You are not focused, not able to find out that what am I doing, switching over from task here and there, restlessness. If this is happening, you need to understand not just the food from mouth, but from elsewhere also, you need to keep in account. Quickly, a cycle of formation of tissues that is there through your food. Again, various doshas and how the taste, six fundamental tastes which increase and reduce the doshas. The important key point here, people counting nutrition or balanced diet with respect to calories, kilocalories, need to just keep a simple thing in mind that your food plate should have a balance of all these six rasas. If that is taken care in right proportion, food is supposed to nourish your system inherently. Diet planning as per the rasas, ritus that has been discussed. One very interesting point people would be interested is how much water should I drink? What should be the timing of water? Ayurveda says water before food intake. People who are on heavy weight and who take like water adequately before food can manage their weight by losing some of it. But that does not mean that you have lot of water. You should be taking it as per your thirst and maintain and mind your portions of water intake, because too much of dilution leads to dilution of enzymes, dilution of pitta, which doesn't which leads to a hypoagni or mandagni. Timing of water in between food intake is good, which helps to stimulate. But again, in between is just when you should understand that when food is slightly dry, you would need more liquids to ensure that there is a good mixing or assimilation that is happening. Water immediately after taking food leads to weight gain, sluggish metabolism. We need to understand that keeping all this in mind, we will be able to arrive at a framework of health, which is not just cure, but prevention. Prevention at all levels, primary, and primary prevention. Primal prevention is something where expectant mothers are made aware and are told about to maintain their own good health for fetal well-being and ensure that gestational diabetes, gestational hypertension, eclampsia, etc. are prevented. Primary prevention is to prevent development of any disease. Once the disease sets in, you need to cure that. You need to cure at an early stage. And then, once the disease has happened, post-acute illness to prevent recurrence and restore health. And for well-being, Ayurveda plays an important role across this cycle of health. And Ayurveda is able to take care of various medical conditions which are laid down here: musculoskeletal, gastrointestinal, metabolic. At each of these disease specialties, Ayurveda system is able to take care. And also a concept which has been there about integrative medicine, where you integrate appropriately, seamlessly with modern medicine for best of care. And as we spoke about people coming with multiple health issues, you could see this around you, that a patient around you is not always with one disease. Multiple health issues, from neck pain to back pain to arthritis to metabolic issues, everything. And keeping this scenario in mind, we understand that good health, you may, with all this, may be able to maintain slightly better blood sugar or slightly better BP. But what about your quality of life? State of mind, sleep, appetite, bowels, are they in place? Most of the patients are not with these things that we spoke of good health in our earlier slides. Lot of time goes in correcting the main issues, but these issues lead to compromised quality of life, and these issues, when not corrected, they are adding to chronic inflammation. And Ayurveda helps to correct metabolism, inflammation. It helps to restore homeostasis and thereby ensures that well-being is maintained. How do we do that? We call it as Ayurveda Chikitsa, the ultimate personalized health management system, which entails a prescription of Ahar, Vihar, Aushad, and Kriya. Aushad is internal medicine as well as external medicine. Kriya is Panchkarma treatments. When all these four things are going hand in hand, we need to understand that Ayurveda physician also makes his or her patient aware about vichar. How is the state of mind of my patient which is influencing? Young patients suffering from irritable bowel syndrome, IBS, most of the times come to us saying that my colonoscopy is normal, my ultrasound is normal, my blood work is normal. But doctor, yet I am rushing to pass stools 6 times a day. I feel bloated. I am anxious. I am not able to sleep. I am losing weight because everything else is taken care. But what is not taken care and understood adequately is patient's vichara or state of mind, which is causing this gut issue. So Ayurveda plays adequate focus to all these things. And with all this, we are also conveying the point of we spoke about genetic profile. So it is not always that genetic or genes cannot be changed. Many people say, I inherited diabetes from my father or mother. No, it is actually the role of stressors from your own diet, from your own life habits, which are leading to these alterations. And maximum alterations happen in your teens and young adult age. How does it happen? It happens through connection of your system, gut, and your brain. This entire thing, there is continuous talk between genes, your metabolome, and microbiome. This is Vata. And by changing your own diet, lifestyle, you can reverse the impact on your genes. And aging, which is by that, you can take care. It's a very recent publication which has come, genome versus epigenome. And with that as a piece, and Ayurveda's Chikitsa Paddhati, Panchakarma treatments, many of you would be familiar about this or would have already undergone. You should understand that one of the tool where people are aware, much well informed about mainstream hospital surgery, how the setup is, but most people are not aware about that Ayurveda Chikitsa Paddhati is also very structured, very well organized. We do have hospitals, NABH accredited, which carry out these activities, these procedures through and through. And these therapies, these are external therapies, cleansing therapies, nourishing therapies that we carry out. And we spoke about body, we spoke about seasons of life, we spoke about multiple health issues and how correlate that with quality of life. We spoke about different uh, different stages of diseases and health where Ayurveda can play a role, how Ayurveda can apply. We need to understand also when we spoke about well-being in our first slide, I spoke about looking inside. So what is inside? So while there are physical attributes, there is something which is not known, and that manas, mind and beyond. We need to understand our own state of mind, our trigunas, about sattva, rajas and tamas. And these trigunas are one that lead to our life choices, the way we react, the way we speak, the way we make, way we are having addictions, affinity towards certain things. These are all indicative of our state of trigunas. We can go into detail if anybody is interested in this. But we can understand that various kind of state of mind, disturbed or a chaotic mind, dull and a lazy mind, because of various doshas that are there. Focused and an integrative, very clear mind towards sattva, absorbed in oneself and oneness. Now, with this concept, with all these principles as a base, Apollo Ayurveda Hospitals has been pioneering in this framework for last 19 years, where we have in our hospitals a unique personalized disease tree framework to handle multimorbidities. Many of you would have already consulted Ayurveda physicians, or you would have somebody in the family, you would have heard about it. But now we are talking about serious Ayurveda. We are talking about precision Ayurveda for various medical conditions with various patients coming with multi-system Ayurveda, Apollo Ayurveda, where we are we are able to tackle these health issues, disease issues through clear prescription where we focus on diet, lifestyle, state of mind, multiple issues, any external factors that a patient faces. And some examples of our patients that we have treated with sleeplessness, anxiety, these are some of the things that young participants here would be able to correlate and would find it relevant in case if they are going through this. Some of the case examples that are there, how do we derive that disease samprapti? We spoke of roga samprapti. This is exactly that framework which is laid down here. We can see here three different patients, three different sampraptis. Outcomes are similar. Outcomes within the frame of time to cure them with Ayurveda system is very well structured, well defined, and predictable. You can see through and through quality of life parameters, sleep, appetite that we spoke of, good health are tracked here. You can even see a unique aspect here of patient reported outcomes, PROM, which has been tracked by the patient himself or herself. We are also into co-managed care, integrative care model, where apart from functional health issues, Ayurveda plays an important role as an adjuvant to primary health allopathy care in various situations like oncology, neurology, stroke rehabilitation, where we are able to appropriately integrate through care cycle. You may see that in most allopathy hospitals, which are now coming up, they are very open to pioneer, we are very open to incorporate this integrative care model where Ayurveda physicians, Ayurveda team, and allopathy specialists work together to bring in the best of both worlds. Some of the examples that of patients that we have treated in our co-managed care hospital in Aster CMI in Bangalore, for example, where a patient was admitted for stroke in a leading quaternary care, and we took through and through with neurosurgery, physiotherapy. These are some of the examples of complex integrative co-managed care that I am sharing with you. With this, we have rigorous outcomes, disease-specific, functional health, international outcomes, and patient satisfaction. At every stage, this is monitored. This to ensure that we are able to deliver and leverage for safe, effective, real-time, and life cycle patient health management. Most of us have this question or dilemma in our mind when we come across various doctors, physicians, corporate hospitals. Is it safe? Will I come out in a good health? Will it lead to some complications? It is so important at this time and era that we are in to ensure and to look for a safe hospital. And how do I know that hospital is safe? Why? How do I know that the approach that a physician is taking safe? You need to be aware that while there are accreditations like NAPH, etc., you need to see how rigorous the system is, how rigorous the documentation is, that how informed care is at every stage of your hand holding with the doctor's team, with the physician's team that is there. You are informed of what is happening to you, what are the treatment objectives. There is a seamless memorandum of understanding between the physician and the patient to ensure that I am taking care of your health to alleviate your symptoms right now. I am accountable to see that you receive good health over a period of time. And I also take accountability, make you and me an active participant in this journey of ensuring good health and sustained well-being. So this is all that we have been talking about: personalization, diagnosis, and plan of care, sustained well-being, state of mind, clinical outcomes. So this is uniquely whole person health tree. Let me quickly sum up that you need to rethink Ayurveda as a modern system which is thorough, which is clear. It is an actionable manual for your life, for how to maximize your immediate and long term health. Firmly grounded in data, real life conditions, Ayurveda system makes obvious which actions we all need to take, and just as important, we all need to pay attention in order to live a long and a life which is filled with vitality. As the most accurate and comprehensive health guide which is published till date. And also, most of you, if you are into current reading, I would like to quote Peter Attia. If anybody is interested, should pick up this book, which is Outlive, The Science and Art of Longevity. It says that we are into the grand decathlon of life. It is not about being great at any one pursuit, but about being pretty good at everything. As centenarian decathletes, we are no longer training for a specific event, but let us become a different sort of athlete altogether in this athlete of life. What separates Ayurveda from others is its unique pursuit of quality of life. And it looks life into physical, emotional, mental, relational, and spiritual. This incredible knowledge is a call to action and a reminder to always participate and never be passive. You are looking for your health and good health. You should be active. Please don't depend entirely on the physician. You need to arm yourself with tools. You need to live a long, meaningful, and fulfilling life. As I mentioned to you, a small art activity that I want all of you to draw and maybe to go back today evening when you can do this. Please write down each decade of your life as in a tree here. Decade 1, decade 2, decade 3, 4, 5, and so on. You can do this exercise for yourself, for your family, for your parents, grandparents, everybody. Under each decade of life, you can write down your health milestones. You can write down your disease milestones. You can even predict your own decade of life ahead. That what are you prone to? And you may not be able to do everything precisely. You may not be able to do this everything correctly. Please reach out to Ayurveda physician who is open-minded, who is well qualified. I am very sure such a physician will be able to fill this timeline of your life very well. And when you do that, you are sure to reach not just 100 plus also 120. With this, I would like to pause and would wait for questions from all of you. Apurva, you can please read out the questions if there are any.
The question is, what if I'm on allopathy medicines? Can I still take Ayurveda?
Yes, Ayurveda can be seamlessly integrated with allopathy system of medicine. One needs to be aware of what allopathy medications the person is taking and for what objective. Ayurveda physician should be informed about this and he or she will be able to guide you on its usage, on its details, on time of administration, and also if there are like overlapping mode of action, doctor will be able to guide you, keeping your safety. Does Ayurveda, there's next question, does Ayurveda is all about vegetarian diet? No, Ayurveda endorses non-vegetarian diet also. Various type of non-vegetarian food in different forms have been listed in Ayurveda, but it definitely talks about the property of food as guru and laghu. Non-vegetarian food by its inherent property may be slightly guru, but depending on your agni, depending upon your metabolism, you can choose well non-vegetarian food, its method of cooking, time of day, etc. So it does say that you should eat non-vegetarian food, but with awareness. Certain things on red meat, etc. There are rules which are told, which you need to follow as per Ayurveda. There is one question from Mr. Vikas, I think one more, about Aster CMI. Apollo Ayurveda is a part of Aster CMI hospital. In case of your any health needs, you can reach out to our team, Mr. Vikas. Where all are you currently present? Apollo Ayurveda is currently present in Bangalore, Kochi, Uttarakhand, Gurgaon, Delhi, and Uttarakhand and Chennai.
I think there are no more questions, doctor.
Sure, Apurva.
There's
Does
one.
Ayurveda cover insurance? Yes, Apollo Ayurveda Hospital is pioneer in insurance-backed Ayurveda. We are empaneled with major TPS and we have an insurance head and a desk which clearly will guide you for further questions on insurance and its coverage.
Thank you so much, doctor, for your time today.
Thank you, Apurva.
Thanks.